Hello, friends and family and people of the Facebook interweb. I said that I was going to release some really awesome news, but before I do that, let me give you a brief history. Um, I've become really open about this in the past 3 to 4 years, becoming more and more open about it because it's become more and more uh, detrimental to me. Um, when I was 15, I started experiencing a lot of pain. I had to stop playing tennis and sports, and um, I was diagnosed with bulging discs. Okay. Um, my friends made fun of me. I'm going to be 28 next month to the date on April 8th. So it'll be 13 years with chronic pain. Very chronic, sometimes debilitating, cannot move pain. So when I first started having it, my leg would go numb. There were times when I thought my kidneys were going to explode. Not my kidneys, just joints and nerves and things. Um, then kind of put it out of my mind. I would move a lot, and friends made fun of me because I would have to leave things early, and they thought I was just being silly, but I was in pain. So when I was in college, it was getting progressively worse and worse because stress exacerbates anything. I had to miss some classes because my legs were going numb. And when I had MRIs done, it turned out that I had a spine disease. At that time, it was diagnosed as juvenile disc disease because I was 18 and I was very young. Still am young. But from age 15 to age 18, my spine had aged to the age of 45 years old. So what this disease is it is a degenerative disc disease. That happens as you get older. The discs in between your vertebrae, they dry up. It happens. Get slip discs, bulging discs. I have a lot of friends that have had them. With me, it is at an accelerated and very, very rapid pace. I've had to stop doing a lot of things as I've gotten older. My last MRI was 3 years ago, and I ended up showing that I had the spine of a 65-year-old woman. So what that means is that most of my lumbar spine, the discs are dried up. So a lot of it is bone on bone, and what is left is slipped or bulging. Nothing is operable because it's not infringing upon the spinal cord in any way, which is fantastic. I also have arthritis, really bad arthritis in my spine. It's spreading up and down. The disc degeneration is spreading. And then my sacroiliac joints, which are those big ball joints in your pelvis, you can't see that, they go like this. Mine move all around, which is what will cause my legs to go numb. So just everything kind of works in conjunction and pinches things off. So throughout the years, I've had to stop doing things that I love. I have to take really good care of myself, but I can't run anymore. I don't really dance a lot. If you see me dancing, you probably should tell me to stop because I love dancing. Sports are a no. Last year I had 2 jobs and I ended up on disability because I couldn't handle it. My legs, I couldn't feel them anymore. So only a couple people have seen me at my worst. Lexi is one of them. Abel, my roommate. My mom and my dad, they've seen me at a pretty awful state. And Evelyn. And you guys have seen me at my worst. And my worst meaning I can't move my head up. I can't move my body. It takes every ounce of willpower and need to get up. It hurts. every day is at a constant pain. My constant is like a 6 for me, which is your 10. I've just learned to deal with it in the past decade. So I have a very high tolerance for pain. It does, however, affect me emotionally. I, of course, have gone through bouts of depression. Very rarely will I have a why me moment. Those usually come when I'm really laid out on my back and can't move. I've tried to adopt the best attitude I can, because it could be worse. It could be so much worse. And what has scared me in the recent years, because I have deteriorated very rapidly in the past 2 to 3 years, very rapidly. What has scared me in the past 2 or 3 years is the fact that I will end up in a wheelchair. I've done so many opiates to kind of quench my pain. They don't really do anything but make me high, which can be nice sometimes. I have an electrical TENS unit, which is a shock machine. I've done epidurals and steroid shots, cortisone shots, steroids. I've sunk a lot of money into acupuncture, physical therapy, and then some more physical therapy, and then some more physical therapy. There's a reason why I go to the gym a lot. And most recently, trigger point injections, which were very painful because I was awake while they stuck a giant needle several places in my muscles. Debilitating in every sense of the word. In the past couple of years, as I've deteriorated more rapidly, I've had to lean more on explaining to people what's going on, so that people don't think I'm a complete flake. I deal with pain in my bones. I deal with pain in my muscles and my nerves. I have chronic inflammation. It's everywhere. I'm exhausted because I deal with pain every minute of every day. And to my friends and family that have heard me complain and whine about it, not that often, I could complain and whine every minute of every day. That's how painful it is. So, the amazing news! In May, my mom had come across a really cool segment on a CBS morning show about this doctor in Texas, Dr. Kevin Pauza, who had found a way to use substances within the human body to build and grow discs. And I cried tears of happiness. Then I found out how much it was. It is tens of thousands upon hundreds of thousands of dollars. No insurance covers it. So I kind of put the thought out of my brain. And then I've just been managing and thinking, well, someday I'll be in a wheelchair. Hopefully not today, hopefully not tomorrow, but it's going to happen. So someone who I was very close to approached me at the end of December and told me how much I shouldn't have to live in pain anymore, and that he wanted to help me and start a fund to get me that treatment. And that meant so much to me, and it instilled a lot of courage in me, because throughout the years I've kind of landed on the fact that this is what I've been dealt with. It's mine. I'm going to deal with it the best that I can. I'm going to manage, but this is it. And so I looked into stem cell here in LA. And last week I had an appointment. I don't want to hear any rants or tirades from people who are opposed to stem cell research, because it's quite phenomenal. And they are experiencing amazing results, not just here in America, but across the world. And here in America, it is approved to use one's own stem cells. So I had the appointment, and this is a clinic in Hollywood who they do vanity things. They help a lot of athletes and rich people, and they're going to help me for free. I'm gonna be a new girl. So, I have my procedure. Oh, I have my procedure on April 2nd. That was decided today. So what's gonna happen? I'm gonna go in on April 2nd, and they are going to drill into my hip bone and get my bone marrow, spin it around and get the purest stem cells, and then they are going to shoot them into my soft tissue. I'm so happy. Although it sounds like a bitch, doesn't it? So they're going to shoot them into my soft tissue, in my spine and my hip joints, and then they're going to take 5 to 10 milliliters and put that in my blood intravenously, because the cool thing about stem cells is that they go where the damage is, so it gets attacked on 2 fronts. Spines are a little bit trickier. In Russia, they're having about a 70% success rate. They estimate me to have a 75 to 80% success rate. So what does this mean? First of all, I'm going to be on bed rest for 2 weeks, maybe 3. Complete bed rest. So for my birthday, I will be down on the couch with the best birthday present ever. So much snot. It's happy snot. So much happy snot. So, I will welcome visitors and people who want to come and just sit with me, because I'm just gonna be laying around. So I haven't really decided what to do for my birthday yet. If I'm up to it, I might just have a big old house party. House party? I might have a big old house party where I will be laying on my couch and you all can party around me. It also means that I can go running, hopefully. I mean, as long as this is successful, which I have every hope that it's going to be. I can kickbox and play tennis and go dancing and maybe one day have kids. Because that wasn't an option. So, I won't need, hopefully, the following things anymore. Hopefully, I won't need this anymore. Karate chop. No more cane. Hopefully, I won't need all the drugs anymore. Boom. Hopefully, I won't need an electrical shock unit for my back anymore. But the most important thing is that it means I might not be in pain anymore. Every day. You're looking at a girl who has a new chance on living. Thanks for watching, and wish me luck.